check for scene safety. The scene is safe. Uh, the mechanism of injury seems to be blunt force trauma. Number of patients is just one. I request ALS assistance. Um, Next, I check for spinal stabilization needs. Doesn't seem to be any need for it. Um, General impression of the patient is a young man sitting in a dugout um, in moderate to severe respiratory distress. His responsiveness, he seems to be responsive and answers questions appropriately. The chief complaint from the patient is that left side chest pain and shortness of breath. I check the airway, and the airway seems to be open and patent. Next, I listen to his lung sounds and check his respiratory rate. I notice he has 24 breaths per minute and has diminished lung sounds on the left side. So I decided to place him on a non-rebreather. Right. Next, I inspect for any major bleeding on the body, and after inspection, I find that there is none. Next, I check his pulse. I notice that it has a rapid, strong, and equal radial pulse. His skin seems to be warm, pink, and diaphoretic. Given this information, I have given him low priority transport. Next, I take my sample history. His signs and symptoms are acute onset of left side chest pain and shortness of breath. His allergies are to penicillin. Medications, yes, he isn't taking any. His pertinent past medical history is that he doesn't have any previous medical history. His last oral intake was dinner about 2 hours ago. The event was he struck in the left side, left chest with a baseball. Next, I inspect the head and face, the eyes, the ears. I notice there are no injuries in that area. Next, I check the trachea by searching the correct placement, the jugular vein, and I palpate the cervical spine. After doing so, I've noticed no injuries in those areas either. Next, I will inspect the chest. After doing so, I notice bruising and tenderness of the left ribs. Breath sounds are diminished on the left side as well. Next, I check the abdomen and the pelvis region. After doing so, there are no injuries there either. Next, I check the lower extremities for pulse, motor, and sensation. After checking, all those seem to be present. Next, I do the same thing for upper extremities. Check the pulse, the motor, and the sensation, and those seem to be present as well. Next, I check the back, the thoracic and lumbar region, and the buttocks of the patient. Again, so I notice no injuries are there. Next, I obtain the vitals, the pulse, blood pressure, check the respiratory rate again, and his oxygen saturation levels. His pulse seems to be a little high. His blood pressure is low. His respiratory rate is high as well. His oxygen saturation levels are within normal range, but we're going to the lower side of the range, so I need to be careful with that. Next, I just stabilize the patient and get him ready for transport to the hospital. And that's it. Thank you.